Hello, I'm Dr. Sundari Mase, Sonoma County's health officer, and I'm here to share the latest updates on coronavirus in Sonoma County with you. As of yesterday, June 21st, we have 885 confirmed cases, up 32 cases in the last 24 hours. 366 are active, 514 have recovered, and we now have 5 deaths, an increase of 1 in the last 24 hours. We've done 41,150 coronavirus tests so far. So today I'm going to talk a little bit about facial coverings because we've received many questions about facial coverings. You may have heard that the state of California on June 18th updated their facial covering guidance to now make facial coverings mandatory, as they already were in Sonoma County. First, let's define what is a facial covering. It's any fabric or cloth that covers the mouth and nose. The facial covering can be made using household items, including scarves, bandanas, t-shirts, sweatshirts, towels, turtlenecks. Any fabric can be sewn by hand or be factory made. Now let's describe when the facial coverings are required. Facial coverings are required in any indoor public spaces at all times. This does not include your home. While indoors, like the grocery store, the pharmacy, physical distancing of at least 6 feet should always also be maintained whenever possible. In other words, facial coverings are required to be worn indoors, whether or not physical distancing is maintained. Facial coverings are also required to be worn outdoors only when at least 6 feet of distance cannot be maintained between you and people outside of those in your household. So waiting in line outdoors would be an exception. When waiting in line, either outdoors or indoors, facial coverings are to be worn at all times, in addition to physical distancing. Groups who are exempt from wearing a facial covering include children under 2, per CDC guidelines, and persons with a medical condition, mental health condition, or disability that prevents them from wearing a facial covering. Times when everyone is exempt from wearing a facial covering include when obtaining a service involving the nose or face, allowing temporary removal of the facial covering, when eating or drinking, provided they're able to keep at least 6 feet away from persons who are not members of the same household or residence, when requested to remove the facial covering by a business for age verification to purchase products including but not limited to tobacco products, alcohol, and cannabis. So we must keep up our vigilance. The pandemic is not over. In the last week, we have seen 127 new cases, and our case rate, as you can see from the dashboard, is above 40 per 100,000. So our community question for today is, who is eligible to be tested for antibodies? Again, antibody testing is a blood test that detects if antibodies to COVID-19 virus are present in the blood. The health department is wanting to understand how much virus there has been among certain high-risk groups who have had exposure to COVID. There's still a lot we don't know about this novel virus, including whether the presence of antibodies means that one actually has immunity to COVID-19. So widespread testing among the community is not indicated at this time. At this time, the following groups of Sonoma County community members are eligible for free antibody testing. First responders, that would include police, fire, EMT, and paramedics, healthcare workers, persons who have already tested positive and recovered, and close contacts of persons who have tested positive and recovered. If you're part of one of these groups, I'm encouraging you to get tested. Please call 707-565-4667 to get an appointment for the antibody test. At this time, no other groups were able to receive the free antibody testing. It's possible that additional groups may be added in the future. If you're not part of one of these groups and interested in more information about antibody testing, check socoemergency.org or call 211. So thanks for joining me today. Please continue to take care of yourself, stay healthy, and we'll talk again soon.